and today I'm going to be demonstrating how to do the humidity competency. So before beginning, you want to confirm the order. You want to check if the patient meets the indications. So the indications for humidity would be the patient has thick secretions, their upper airway is being bypassed, or they have upper airway edema. Some contraindications would be that the patient has hyper-responsiveness in the upper airway or experiencing a lot of bronchoconstriction. Then I want to check the medical record, and I'm looking for vital trends, chief complaint, medical history, medications the patient's using. I also want to know what type of oxygen device they're on and how long they've been on that device, and any other relevant data. Then I will go ahead and gather my equipment. So first I'm going to need corrugated tubing. I'm going to need a large volume nebulizer, a water trap, and a aerosol mask. And I'll also be needing some gloves. And then once I have my equipment, I can go ahead and prepare to enter the patient's room. So knock knock. Hello, hi, my name is Brianna. I'm with a student with the respiratory department. And before beginning, can I get your first, last name, and date of birth?
Yeah, NRT is 3.1.
Okay, great. Just let me wash my hands really quick. Can I go ahead and see your wristband as well? Okay, great, thank you. So today I'm going to be adding some humidity to your oxygen. It's pretty much going to relieve some of that swelling you're feeling and help mobilize some of those secretions that you have. Okay, and we don't anticipate any complications, but some that could arise would be contamination, such as like bacteria in the tubing, or you could feel like overhydrated. So we'll make sure to help avoid any of those complications. Do you have any questions?
No.
Okay, and you understand the procedure? Okay, great. So before beginning, I'm also going to want to check your vitals. So I'm going to lower the bed, and I'm going to help you. Okay, I think it's low enough. And then whatever side you're comfortable with sitting on the edge. And put my gloves on before. So I'm assessing my patient. There's no visible sign of cyanosis. She's not using any of her accessory muscles. She looks like she's comfortable at the moment. Okay, so I'm going to put this on your finger, and you can go ahead and relax your hand on your lap. And make sure your pulse is in rhythm with the pulse ox. Okay.
That's what Mrs. H uses on it. You don't have to have your meeting.
Okay, great. So now go ahead and take this off. And I'm going to listen to your breath sound. So when I place my stethoscope on your back, I want you to take a deep breath in. I'm going to start back here. And I'm also going to be listening to the front as well. Deep breath in. Listen to this side. Thank you for being so cooperative. Okay, so now I'm going to go ahead and get everything ready. First, I want to try to not contaminate the tubing. Make sure I got the right one. Okay, so I'm going to get my large volume from the water trap. Okay, so I'm going to put her in about 5 liters, and I'm going to put this to the 28%. That way I can give an exact FiO2. And that is so that the LVN can humidify the right amount of dose. So now that my tubing is contaminated, I'm going to go ahead and replace it. So let me get another one. Alright, so now I have a clean, sterile tube. It's probably better to attach this. Try doing this. So that should be tight enough. And I could connect it to my water trap. And then you want the water trap at the bottom of the bed so that the condensation could collect into here. So I'm going to raise the bed just a little bit. Okay, so now that it's secure, I can go ahead and grab the other piece and connect it to the aerosol mask. Before attaching this, I want to make sure so now my tubing is all connected while maintaining the sterile, and I want to make sure that I see some aerosol coming out. So you can hold it up to your shirt, kind of see if you see anything coming out to make sure there's adequate humidification. Okay, so I can feel some coming out. Okay. Now I'm going to attach this to the patient. So I'm going to go ahead and ask that you lift up your head a little bit, and I'm going to help put this over your face. And it should be a little over your ears. How does that feel? Feels good? Are you comfortable? Okay, great. And do you feel some of the humidity coming out of it? Okay. So it should take about 15 minutes for it to kind of go in there and relieve some of that swelling you have. And if you have the urge to cough, you could just take it off, and I'm going to give you a tissue in case you have to get some of those secretions out, okay? Alright, and I'm going to go ahead and just check your oxygen really quick, so I won't make you get out of bed all over again. You're looking really good, and let's see, is there anything else I can do for you before I go? Okay, so if you need anything, my name's Brianna. I'm going to go ahead and leave your call button. So I think if you press this button right here, I can come and get you whatever you need, okay? And let me get going. Thank you very much for being so cooperative. I'm going to throw away my gloves.